My name is Jodie Heap. I'm principally a dentist in private practice, but I've also doing some research around ethics.
So my name's Catherine Benzer and I work for Colgate. I'm an oral care consultant.
My name is Rachel Callender. I am really passionate about effective communication in healthcare from a parent point of view, to then use my experience to help engage and empower parents, professionals and patients in their healthcare journey.
My name is Alison Bettiger. I'm an oral health therapist and I work at North Richmond Community Health.
I'm Katie Theodore. I work at Dental Health Services Victoria and Deakin University, and I'm here today as a representative of the Victorian branch of the Dental Association.
My name's Matt Loades. I'm from the Centre for Culture, Ethnicity and Health in North Richmond. I work in communications.
My name is Jenny Wilkins. I'm at the conference because I have a background in oral health.
My name is Linda Slacksmith and I'm from the School of Dentistry at UWA.
My name's Lenore Tuckerman. I'm from Colgate in Sydney. I'm in the sort of National Dental Science Liaison, which is a funny sort of title, but I work a lot with public health.
My name's Paul Beath. I'm a general dentist from New South Wales.
My name's Owen Jones. I've been involved in Oral Health Services Tasmania for the last 8 years. Current role there is basically around education for clinicians, education for patients, education for the organisations.
My name's Ajesh George. I'm from Western Sydney University. I'm an associate professor there, and my area is in interdisciplinary oral health care. So I'm here at the conference basically to listen to everyone else and see how we, from different perspectives, from patients, carers, and from other disciplines, and how we can work together in improving oral health care.
My name is Lucy Mays and I'm here because I wrote a book which was released at the end of last year called Beyond the Stethoscope, and it's a collection of doctors' stories around themes of reclaiming hope, heart and healing in medicine.
I'm Anjana Castro. I'm a dentist from North Richmond Community Health.
My name is Joyce Tam. I'm a dentist from Your Community Health. This is actually the third conference that I've been to in a series, and I enjoy coming to these conferences because they always bring a really wide mix of people to come and talk about issues that involve oral health. So we do have dentists, but we do have medical people, we have pharmacists, we have patients, we have authors, so it's really fantastic to hear about their points of view.
It's amazing. It's what is so rich is the huge array of different perspectives and professionals, and I find that that's quite unique actually in a health context, to bring together lots of different voices.
I think it's great. I think it's great to hear the consumer side of healthcare. As an interior designer, it's great to hear voices that we may not normally get to hear in an industry that we're designing for.
Lots of interesting people, great people at North Richmond Community Health.
In terms of the conversation that's happening between consumers and healthcare professionals, it's been very stimulating and provided me with some ideas to take back into my own practice.
One of the criticisms of small boutique conferences like this is that you end up talking about things like preaching to the converted, so to speak, and you're connecting with people who all already care about all the things that you're talking about. But I really enjoy spending time with people who are on the same page as me and who care about the same things as me, and networking with those people.
It's really good to have a good cross-section of providers and consumers talking about these things, which it's good to see everyone being so passionate about what we think is important in providing healthcare.
I'm just really excited that this conference exists, mainly to reiterate what you've said, Katie, because I think the more that people are talking about these issues and actually coming up with solutions to these issues, then the solutions will present themselves, and then we'll start to see change happening and better healthcare structure and better healthcare systems for everybody.
It's really interesting. The topics are quite diverse, covering a lot of ground. It has a great atmosphere and it's been very well run.
Very exciting, very interesting topics.
The conference is great. It's been it brings in a whole range of people that you wouldn't normally see. There's a lot of medical input and allied health input, and it gives perspectives that we wouldn't normally get.
It's one of the few conferences where I've had such diverse people coming together and giving their own perspective on what we need to address in care, ranging from ethics to the carer's perspective. And this morning we heard a lot of stories about consumers and how they've gone through the health system and what are the challenges that we need to address.
I'm really enjoying the conference. The speakers have been really interesting.
This sort of gathering, as I say, it can be a bit of a tonic for you as well, and you can actually go away and actually feel refreshed and think, okay, yeah, we are making progress.
The learning from this conference that I find most exciting is that I then get to hear from the professionals' point of view that the biggest struggles and challenges and problems that they face, to then feed that into the work that I'm doing.
Well, I think for me, just hearing from people, for someone who's working more with communities directly, hearing more about people who are working in the health system, nurses and doctors, and the kind of environment that they're in, I think that's been very interesting.
I got a definite feeling today as well that we seem to be allowed to, or the feeling is that we should be allowing ourselves to be people as well. Not just clinicians, not just doctors, not just dentists. Actually, I'm a person as well. And I can actually tell you that I want to look after you.
Look, I think it's a way of thinking, and we all know what the way of thinking is, and we've seen it happening, but it brings to light what needs to be done and some of the nuances around what patients feel and how they feel, and it gives us some insights into how to interact with that clinically. And that's my focus at the moment.
I'm going out to buy Susan Albereti's book today because she was very inspirational and had me in tears.
I think for me it's just inspiring hearing other people's stories where there wouldn't normally be a safe place to talk about healthcare in that way, because not many people open up about that sort of thing and their experiences as being a carer and being a consumer in a safe place. So that, I guess, has been really inspiring to just hear those voices and to try and work out ways that we can listen to that more and design for that.
I think a lot about working more collaboratively. So we've had some discussions within our speech pathology team about how we can incorporate different questions potentially in our intake service or our intake process. How can we, introduce questions around oral health?
Yeah, I think already today we're thinking very much about how to be collaborative with other sectors and make those partnerships with what we do, and thinking about the broader picture.
This morning we heard a lot of stories about consumers and how they've gone through the health system and what are the challenges that we need to address from a healthcare provider's point of view, because we tend to obviously have a one way of looking at it, being a healthcare provider, but learning the patient's perspective and seeing how that can influence the way we make decisions and involve them in the care. I think that's very important.